All right. Hi, you guys. My name is Tanya Roundhorse. I am a physical therapist and I am the founder of Refining Wellness. I'm a women's health physical therapy business, a practice out of Orange City, Iowa. Today, I want to share with you a topic that's been on my heart for a while because it's something that I've seen with women throughout the years, but more so, especially right now, as I am seeing just pregnant and then postpartum women, and also teaching women in my online courses. And so, if you are a pregnant woman or a postpartum woman of any amount of days, months, or years, this is a topic that might interest you. So, after you give birth, typically most women have a 6-week follow up with their OB or primary practitioner after that point. I myself had this with all 5 of my children, and with my first baby, I had an episiotomy plus a 3rd-degree tear, and then with my next 3 babies, I had a repeat episiotomy. With my 5th baby, she was the only one that I did not tear with, praise God. Anyways, I had this follow-up appointment, and at this time, they typically do a pelvic exam. They'll do a quick pap smear and just check to make sure everything looks okay. Assuming all looks well and has healed well, they will give you permission to resume exercise or normal activity. I've never heard typically of a woman, I'm sure they exist, that there are women who have been told, no, things haven't quite healed well, you need to wait a little longer. Maybe if it's a 4th-degree tear or something surgical, but most women are giving clearance at that appointment to resume normal activity. Now, if you are like me, or probably more like me several years ago, where you love to exercise. I still love to exercise, but perhaps feel like exercise is a necessary thing to get back in shape, to lose weight, or just as something you have maybe a little slightly unhealthy even attachment to. And no shame here because I've been there and sometimes I can still be there. We often want to get going right away and jump back into activity. So say you're a runner and you were running 3 or 4 miles a day, either prior to pregnancy or maybe even during a chunk of your pregnancy. You might be like, okay, I'm going to go out and run 3 miles today. Logically, we don't always think, you know what, maybe I should just try to do kind of a jog on and off for a mile or something like that. We typically think, I'm going to go run 3 miles. It might be a little slow, but I'm going to do it. I want to share with you why this is unhealthy and why you should not just jump back into activity like normal, okay? When you carry a baby on your pelvic floor for 9 months, it's going to get weakened. So whether you have a vaginal birth or a cesarean birth, it's going to be weaker than it was prior to pregnancy. In addition, you may have a diastasis, and I don't know about your practitioner, but the ones that I know about are not checking for a diastasis, and no shame on them. They have 100 things that they care about and are checking. So that's where a physical therapist is an awesome resource to check if you have a diastasis. The other thing is, are they checking your pelvic floor strength? Are they having you do a Kegel? And even if you can do a quick pelvic floor muscle contraction or a Kegel laying down while having a pelvic exam. I've never actually heard of a practitioner do that, but maybe they do. Does that, what is your endurance? What is your power? Can you do that in multiple positions? Or is it just laying down? Because that's the easiest position to do it in. You have a gravity helping you out. Can you do it in a gravity resistant position? So there are all these things that go far beyond, are we just healed? And actually, is the tissue, number one, strong enough to handle a higher level exercise or activity? What is the endurance of the muscle in the deep core? Is the deep core even working? Is the brain still have this connection from to the deep core? And is it contracting how it's supposed to be and kicking in how it's supposed to be? My clinical experience and research has shown that it absolutely is not in almost all postpartum women. These muscles and the connection, the neuromuscular connection from the brain to the muscle are not working like they were postpartum. And so it is a smart idea to reestablish those connections so that you can do the things you want to do and not get injured along the way. So if you are someone who has your 6-week checkup and you're like, things just don't feel totally right down there, but they told me I was fine, so I'm just gonna go do my run or do my CrossFit workout, whatever. No. If they don't feel right down there, something is still going on and we need to correct it before we jump back into movement. If you are still having some lingering pain, like say I had a patient who was having lingering pain on her runs, that is a problem. Don't just say, oh, I just gotta push through that, my body will get used to it. No, that's a sign that something is not right yet, and we need to do a little bit of work so that you can run, so that you can move and not get injured, so that you can do what you want to do for years to come. So don't just think about right now at this moment. Think about, what do I want to look like in a year? Or not, what do I want to look like? Like, not like my body, but what, I mean, you can think that, whatever. That's a part of it. But what do I want my life to look like? What do I want my activity to look like in 1 year, in 5 years, in 10 years? Because I talk to women all the time who are struggling with chronic low back pain or chronic pelvic pain or leaking urine every single time that they want to go for a run, or pelvic organ prolapse because they did not take care of these things right away postpartum. So if you are a prenatal or postpartum, if you're a prenatal mama who hasn't given birth yet, see a PT right away postpartum. I advise in the first couple weeks and then again at 6 weeks, okay, after you've been cleared by your doctor, so we can really see what's going on. If you are a postpartum mom that is 5 or 10 or 20 years down the road, there is still hope for you. People assume, they're like, well, you really can't do anything for me anymore, can you? Yes, I can. I've seen women at 50 years old heal from diastasis. I've seen women in their 50s and their 60s have improvement with incontinence. So you are not too old for these things. You have muscles, you have a brain, and you have the neural connections to still have improvement in these areas. So if you are not local to me, you can make an online appointment. If you know a women's health physical therapist, by you, someone who is trained in women's health, I would advise you to see them. You guys, a couple appointments is no big deal when we're looking far down the road at where we want to be. All right? Hope you have a great day. Bye.